So the next speaker is David Demortain. You have your presentation.
Yeah, it's coming.
Okay.
Well, thank you. Thank you so much. Very glad to be here, and congratulations on putting together the event and this diverse set of speakers. Delighted to be here with you. Here it is. So we're going to go back to a conversation that sort of started yesterday about how the industry, and in this case it's going to be about the chemical industry and the agrochemical industry, how they use right here science, and how by using science they succeed somehow in shaping regulation, shaping regulatory frameworks in ways that obviously advantage their business. So I was saying this conversation started yesterday. We had the talk by David on the production of doubt and the triumph of doubt. This all relates to what you could call, more broadly, corporate political activity, and corporate political activity using science, meaning enrolling academic scientists and experts, and enrolling or even constructing certain kinds of science to influence regulatory frameworks, as I was just saying. Thanks to the work of David and also other historians of science or many different people, we have nowadays a good understanding of what's called the playbook of corporations and firms towards science. You have here quite a list of now kind of standard practices of corporations, from tobacco to fossil fuel industries to chemical and food, and I guess we'll learn about this later with Melissa's talk. You have a good catalogue of these practices in an early book called Bending Science by McGarrity and Wagner, quite contemporary of David's books on Doubt is our Product. And in this repertoire of practices, there's one that's of interest here in my talk, which is the practice of constituting what's been called a front group, so a sort of front organization that is going to be, let's say, constituted as in appearance, a neutral and objective kind of organization. So this is called a front group. You could put in that category all sorts of think tanks and various kind of science-based platforms. And this use and this constitution of front groups, historians have shown, have really started in the US in the 1970s and has become, again, some sort of standard practice across different industries. And you have here a number of examples of front groups, and so, as you can tell from their names, it's difficult to trace their existence to corporate funding and corporate intervention and American Industrial Health Council. Well, there's industry here, so an outlier, but for the rest, you would have trouble detecting that these organizations have been set up, are funded, and populated often by industry staff, among others. And the one that is going to be interesting me here, and it's going to be the focus of my talk, is the one in the middle, the International Life Science Institute, and I'll talk a little bit about the two others below. So basically, three questions. that I want to address here in this talk. How do firms operate through such front groups, and what do they achieve by lobbying through science? Is this capture, or how can we qualify this? Is this regulatory capture or something else? I'll have a word about this, and tentatively discussing what we could call epistemic capture. That will be a short final point on the environmental crisis and the environmental emergency. What link can we make between lobbying through science, the shaping of regulatory frameworks by the industry, and the ways in which the environmental emergency and crisis is addressed or not addressed. So I'll start with the more theoretical point about capture and why I'm suggesting to speak of epistemic capture. So, well, as you know much better than me, regulatory capture was first sort of characterized and analyzed by economists. So, with this who characterized that situation as one in which regulators sort of end up serving the interest of the regulated industries. What's interesting is that regulatory capture, perhaps not as a concept or mechanism constructed by economists, but as a broader theme, has been sort of taken up by historians, political scientists, and others. One very useful contribution in this field is the book by Daniel Carpenter and David Moss on preventing regulatory capture. And they actually give a few elements on about the difficulty of handling that notion of regulatory capture and of diagnosing regulatory capture. They have an argument in this book that regulatory capture is maybe over-diagnosed, that we kind of detect or fear to see it in many situations, but that is actually quite difficult to pinpoint situations of regulatory capture because it's an interest-based reading, and it's sometimes difficult in particular situations to analyze those interests and see which side wins, because in regulation often there's an intertwining of actors, of regulatory actors and private actors, and it's not always very easy to attribute one particular interest to each actor, and so on and so forth. But they put forward in that edited volume, there's one chapter that's kind of, well, at least for a sociologist and political scientist like myself, quite a useful one, a notion of cultural capture, whereby James Quack, who developed that notion based on the study of capture in the financial sector, suggests to look at capture more happening at a more sort of upstream level, not in detailed regulatory decisions, but sort of at the intellectual level in terms of, what's the policy, what's the regulatory framework that is in place, and how this emerges from repeated, close-knitted interactions over time between regulators and industry circles, as well as a whole population of experts that navigates between the two, and it's quite a useful way of approaching the possibility of capture using that sort of perspective on what are the cultural, the cognitive, and I'll say later the sort of epistemic notions, the ways of thinking and the ways of knowing the risks that are shared by the various actors of the regulatory space, if you will. So epistemic capture, that's a proposal. That's a term that you find here and there in the literature, but that hasn't been very much operationalized. But you could describe it as a situation in which a particular way of knowing and addressing a regulatory problem is shaped by knowledge, so some concepts, some methods, metrics that can be traced to regulatory firms and that tend to generate a favorable outcomes when applied. So this is the perspective that I'm suggesting applying here to this case of the International Life Science Institute and what I call the regulatory concepts that have been articulated by the International Life Science Institute, or to put it more in a better way, in the networks that have been orchestrated and maintained by firms acting through the International Life Science Institute networks, including experts from academia, from industry, and regulators and the like. And I'll have multiple illustrations of this. When I say regulatory concepts, and you'll have to bear with me here, we're going to dive a little bit into chemicals regulation and some technical notions in that field. But these are regulatory concepts are ideas that you find ingrained in the regulatory framework or even in regulatory practice, and that are ways of tackling, ways of regulating chemicals. So here, to take one example, the acceptable daily intake is the notion that you can address the risks of being exposed to a chemical if you calculate the dose over which it will decisively become more toxic, and that there is such a dose. Below that dose, exposure to a chemical is safe. So this very notion, this very concept, is a scientific concept, in the sense that you have toxicological, statistical knowledge behind it. You have to calculate a dose response, but it's also a regulatory concept, meaning that it provides us a sort of ready-made solution and way of addressing chemical risk, saying if you ensure that you're not exposed over a certain dose, things will be all right, let's say. And the acceptable daily intake is one example of a concept that has been articulated in, let's say, ILSI orchestrated kind of networks, and that have been inscribed in the regulatory framework and in regulatory practice. I will spend a little bit more time on the last one, the notion of a mode of action. And again, I'll try to. I'm not a toxicologist myself, but having been through the process of learning what this was all about, I have hopefully gained an ability to also convey what it's in a simple way what this is about. So anyway, ILSI. The International Life Science Institute. This is a non-profit charitable organization created in 1978. I was saying that this practice of creating front organizations really started in the 1970s in the US. So it's part of that movement, if you like. It can directly be traced to the action of Coca-Cola and its vice president at the time that needed to create an organization through which it could disseminate some science that would help frame or redirect the controversy around caffeine toxicity. And this is an organization that became larger over time, that has created branches over the world. It is funded by quite a large list of large corporations from the food sector, chemical sector, agrochemical sector, pharmaceutical sector, too. Even though it seems, at least that's what's conveyed by people I interview, it is always apparently Coca-Cola that is mostly influential in the running of ILSI. So you should not think of ILSI as a large corporation, if you will. It's actually a quite light organization. You have here an excerpt from its budget. It's not a massive budget. Also, if you visit their premises and if you try to see how much staff they have, this is not a very large staff, and this is it is probably intended like that. I mean, it's probably intended by these firms and by its funders that it remains a sort of light organization that can network with others, but that is not in itself a sort of very visible sort of center of political activity. ILSI, and there has been investigations by journalists and researchers over time since the mid 2000, is clearly used as a vessel for lobbying, in the sense of direct access and direct intervention on policymakers and legislators and the like. So we have evidence of that here. A quick reference to an affair about Coca-Cola using the contacts that ILSI has managed to make with governments to actually lobby on the issue of sweeteners. And there's this 2019 paper by Steele et al. that has sort of covered many of these actions of firms through ILSI. What's interesting is that ILSI took the time to respond to Steele's paper by saying something that they actually often say, that they did repeat to me in interviews, and that this characterization of ILSI as a lobbying organization is improper because they don't lobby. And of course it's a rhetoric, and they want to retain the sort of identity as a sort of science organization that has some distance with special interest and financial interest. But I think it has some truth to it, this notion that they don't lobby, in the sense that they, even though at times the organization is used to make contact with and influence people in government and regulators across the world. Oftentimes, the key mode of operation of ILSI is to produce publications and disseminate concepts that, again, are going to shape the regulatory framework without the need to actually, for firms to directly intervene on regulators and legislators and others. So this is quite, that comes out of their own way of presenting themselves in ILSI. Here an image that they often use. They introduce themselves as a neutral forum, bringing together academics, industry representatives, and members of government. And again, saying we don't lobby. We just orchestrate the possibility for these actors to meet and exchange and dialogue. So of course they do a little more than this, and they are a little more instrumental than this. But still, again, there is some truth to that notion, in the sense that ILSI does not directly make contact with governments and regulators to sort of directly suggest so a decision or measure that is in the interest of one of its funders. And on the right hand side here, you've got sort of the chart of ILSI, and I've highlighted this part of the organization that is the key part of the organization, the task forces and the expert groups that it's setting up to address to try and push particular concepts. And a lot of the budgets of ILSI and a lot of its activity is oriented towards this setting up these expert groups, populating these expert groups, and then disseminating their work. the key modus operandi is to try to ILSI oftentimes pick up ideas for these regulatory concepts from the firms that fund it and from associated scientists. Oftentimes concepts that will be effective because they address some need of regulators for how to regulate chemical, for how to regulate things that are quite often complex and uncertain. Then it creates a working group and tries to, well, invite as broad as possible a set of scientists, even those that are presumed not to be sort of on their side, to further articulate the concept and give it credibility, and then disseminate it as much as possible through publications, reports, and by having the members of their working groups to meet regulators and again repeat the concept, repeat the sort of gospel they try to create. So why do these regulatory concepts like the acceptable daily intake or again the mode of action, which I'll present in a second, why do they work? I mean, why do they have an impact, and how effective are they in terms of shaping regulatory thinking and regulatory knowledge, if you will? So just a few quick elements. They are science-like because the ILSI in its publications make sure to develop the actual protocols by which they can be applied, the methods, and they respond to what the historian Ted Potter has called the mechanical objectivity, by providing a sort of transparent procedure and a step-by-step procedure to apply. They ILSI provides a sort of method to depersonalize judgment and to reduce uncertainty, and I think it's a key element for it to explain why the concepts that come out of ILSI stick. It's consensual, and ILSI is very strong at sort of manufacturing a consensus around a concept by having groups of scientists from diverse backgrounds to defend the same concept. It's standard, and I think I'll stress this, it's very important. The concepts that ILSI sort of articulates are proposed to regulators on in various countries, in Europe and in the US, and it's always a factor of success here because regulators do seek some level of harmonization always, and so the transnational action of ILSI is very important. And final point, the links with the special interest and companies that fund ILSI are often erased or diluted, in the sense that companies and ILSI even do not necessarily appear upfront in the publications or in the activity of its experts. I have a picture here of I'm using quantitative publications analysis, scientometrics, to try and illustrate these sort of channels of influence and of ILSI. And what you have here are all of the institutions that co-publish papers with ILSI, and it's the corpus of publications was produced by collecting any publication that comes out of ILSI, and then analyzing all of the institutions to which the co-authors in these publications are affiliated. And what's interesting here is to see the very large number of universities that co-publish papers with ILSI, and sort of behind which sort of ILSI and firms are almost hidden. So what do I have here? The mode of action. How much time do I have left? 10 minutes. So I definitely don't have time to do that sort of case study in full detail, but let me still try, because it's very illustrative. Mode of action. The mode of action of a chemical is the way in which that chemical is sort of active in the body. seen at the cellular level. So it's a concept that comes from molecular sciences, molecular biology, molecular toxicology. And it's an important part of this science of toxicology, and that emerged as early as in the 1960s under the language of mechanistic toxicology. And this was, at the time, a very, let's say, revolution of toxicology, because initially toxicology is a sort of very descriptive science. You test chemicals on animals, models, and you see observable signs of toxicity. And based on that, and also based on the number of rats that die from being administered a certain chemical, you would say this is dangerous or this is not. That's toxicology. Toxicology sort of 101, the very basic approach to toxicology. Mechanistic toxicology is about saying, okay, it's good if we know how many rats are dying and what are the observable, visible signs of toxicity, but to scientifically understand better what's toxicity, we need to look inside the body at the cellular level, how one chemical does what it does, to the body. And this sort of mechanistic toxicology, you see it emerging or being articulated and pushed in the 1960s and in 1970s, before ILSI was created, but already in certain institutions that in the UK or in the US were taking care of, again, working at the interface of academia, government, and industry. And BIBRA in the UK is the key institute for this, and the Center for the Chemical Industry Institute of Toxicology in the US is the other. So industry has taken interest in mechanistic knowledge, starting in the 70s, but much more in the 1980s, for one reason, and I'll move right away to that slide. And again, you have to bear with me here while I'm into the technical detail, but explaining the mode of action of a chemical helps chemical companies sort of defend their product. Oftentimes, regulators would say, animal tests show that a chemical produces certain toxicities. Okay, then firms can come up with the question of, sure, you see that in animal tests, but what about the human population? Will this verify in the human population? And that is where the mode of action argument is really instrumental, and mode of action research is very instrumental in the sense that companies invest research on showing that the mode of action that is observed in animals will not exist in humans. And therefore, with that mode of action argument and what they call the relevance of the mode of action for human argument, they try to save their product from being regulated or banned. So that's the mode of action concept and the relevance concept. And ILSI has been instrumental in articulating that concept and articulating the methods for demonstrating the existence or the absence of a mode of action. Quite early on. So you have, I'll show a few publications through which you can trace the activity of the International Life Science Institute on this. So apparently in 2001, an expert working group was established on this issue, bringing together people who were at the EPA, at the Environmental Protection Agency up until then, or Betamic is a Canadian chemical regulator, and various academics, toxicologists and biologists. ILSI has also, firms funding ILSI have also funded a particular program on mode of action research, and again you have here a broad set of scientists who were brought in this working group from diverse US-based universities, people who were in the former civil servants at the Environmental Protection Agency, or a key protagonist in this story, Alan Bubis, a UK-based toxicologist at Imperial College, who is using all of his sort of credibility as a toxicologist to push that concept and bring scientists to work with him in ILSI working groups on this concept. What has happened, which is again very key to this history of how firms shape regulatory frameworks. So the ILSI working group has created a method for studying mode of action and has pushed that method at the WHO, in particular in this IPCS, which is the International Program for Chemical Safety of the WHO. Basically, all of the actors that were involved in the ILSI working group moved to IPCS and also transposed the work done in ILSI into a sort of guideline with the WHO stamp on. Again, you see a long list of scientists who participated in that, with again scientists from industry, scientists from various regulatory groups, and from diverse universities in the US and in Europe. Moving on, I was saying a key element of this whole, let's say, more epistemic influence on the regulatory frameworks is linked to the transnational nature of ILSI and of its action, and you see it here with the move of that subject, mode of action, to Europe, and the European branch of ILSI also took it up a little later, around the year 2009, with similarly a working group developing methods for establishing, ascertaining sort of modes of action and their absence in humans. And here you have the long list of organizations that were, somehow through their own experts involved in this, in the effort that was orchestrated through ILSI. And you have key all European agencies: the European Chemicals Agency, the European Food Safety Authority, the Joint Research Center of the European Commission, the OECD, and again various other organizations. You also see here popping up ECTOC, the European Center for Toxicology and Ecotoxicology, which is not truly a European research center, but again also more of a front organization where industry scientists push concepts and proposals in Brussels towards regulators. Here again an example of the key publication that came out of ILSI.eu work on this issue, and again the list of participants is interesting. You have Alan Bubis, I mentioned, Helmut Greim, who is a famous German toxicologist who's apparently involved in some ghost writing. John Doe is a former head of human safety at Syngenta. Neil Carmichael is the former head of R&D at Bayer Crop Science. And around them, other academics were sort of joined the effort. Again, if you use, and I'm coming to my conclusion very, very soon, if you use this scientometric method, you can actually see the result of all of those efforts. What you have here is so I've collected all publications you might find in the web of science related to the mode of action of chemicals, and try to analyze and visualize the co-authorship networks in that field. So who develops and publishes paper together. And what you have here at the bottom is this this set of authors that work together to publish papers on mode of action, thanks to the International Life Science Institute. And zooming on, it's quite interesting to see the interactions that this activity of developing papers and methodologies on mode of action has helped establish between various academics, firms, and regulators, which I've highlighted here: the European Commission, EFSA, the US EPA, the OECD, the National Toxicology Program in the US, and up there the WHO. So this is one way of capturing or visualizing the kind of networks that the activity of ILSI, by bringing together scientists that come from these various organizations or are going to work and dialogue with these organizations, helps putting together. I realize I had other slides behind to show how mode of action methodologies are actually used in regulatory practice, and whether and how they create favorable outcomes for firms. So just very briefly, you actually see the impact of all these activities actually on regulatory practice and regulatory decisions here. So a report established by European pesticide regulators. They write up these kind of reports to analyze all of the studies related to one chemical or a pesticide and decide on whether it's safe or not safe. And you see here popping up in the middle of a discussion on the toxicity of a pesticide, the notion of mode of action, and a reference to an ILSI ILSI-derived kind of paper, Holzapfel et al., that the applicant, the firm that applies for the marketing authorization, is able to invoke in this regulatory process to defend its products. So obviously I would need to multiply those cases, but you do actually see those concepts surfacing again in the regulatory negotiations between firms and regulators, and how this helps shaping favorable outcomes. Not always, but that happens. My conclusion is, on science, I'd like to stress that, it's lobbying through science, and I've tried to show that indeed, through those front groups, firms were succeeding in embracing and using the language of science, and appearing science-like with the development of these protocols, apparently replicable protocols. These I haven't had time to illustrate it, but this argument that you find in their publications always: we need to know more about mode of action. Further research is needed. So you regulators don't conclude too quick on modes of action. There's uncertainty. You need to study them more closely, and we provide methods for it. And the use, obviously, of peers, the language of the use of peers to propagate these concepts. Instead of direct action by firms, it's action through scientists, counting on the relation that academic scientists and industry scientists have among them. Capture. What's interesting, and I hope you have gathered from my presentation, what you have here is more of a sort of diffuse mode of lobbying, more diffuse mode of intervention, using the fabric of the regulatory space, the fabric of these interactions between regulators, public scientists advising them, industry scientists, and sort of using those interactions and those channels to disseminate a concept, with difficulty to attribute these interventions back to a special interest. And I think it's a key element of these strategies, is the idea that firms and their interests sort of hide behind a more try to actively hide their interventions. Therefore, it makes it difficult to speak about capture because it's difficult to trace the favorable outcomes back to a special interest. And do I have time for this environmental crisis point? It's no.
2 words.
2 words. Through a concept like mode of action and most of the other concepts that the ILSI is pushing, there's a strengthening of the focus of the regulatory framework on chemicals and on this issue of producing strong evidence of a link between a risk, a safety issue, and one given chemical. And further research is needed, in my case too, but there are ways of showing that this is distractive of a focus on another kind of approach to chemicals, which is in terms of the overall burden that chemicals have on the biosphere and on population, and on the sort of more global take on chemicals and more global action on chemicals. And again, I think through with this lobbying through science, there's a strengthening of a regulatory framework of a certain kind, focusing on chemicals and distracting from even posing the problem of the overall environmental impact that chemicals have on us and on the planet.
Thank you very much.
Many thanks.
Thank you for this presentation. Thank you for unveiling this perhaps unknown way to capture regulation that is not exactly providing biased science, but framing the conversation, the scientific conversation. We will be able to take one question. So the first one.
So one of the things that you just finished on was the difficulty in tracing front groups. If you were to move into a new area, how would you go about figuring out what is a front group? What things would you look for?
Yes. So how did I? Well, first, how did I spotted ILSI and other front groups? I guess you need to go back to their funding. That's a clear, simple way of finding the links with particular industries. But I would say you also need to go and study in detail, almost on site. Who's there, really, who's there, and it's a very important aspect of the characterization of ILSI as an industry group, because, as I've conveyed, they say they're neutral, that they create working groups with an equal representation of academia, government, and industries. But if you look in practice, basically, their working groups would have perhaps half of their people would be from industry, there would be 2 or 3 academic scientists who bring this sort of credibility and to the group, and perhaps one regulator popping in at some point. But so you actually need to go and see who's there, who says what, and to be able to detect in the contributions of various people the trace of industries, strategies, and interests. So you need to investigate.
Thank you very much. So we have now to put an end to this very interesting session. We will have the coffee break, and without any further delay, we will have a second session this morning, because we have 3 presentations during this session, and so we don't want to be too late, but I have a lot of questions for you and also for you, Thierry.